Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today I want to walk you through an important update on Entresto, a medication used to treat heart failure, and explain what it means now that a generic version has been approved. Let's start with what Entresto is. Entresto is a prescription medication made up of Sacubitril and Valsartan. Entresto belongs to a drug class of medications called ARNIs, which is short for angiotensin receptor neprilysin inhibitors. Here's how it works. Sacubitril blocks an enzyme called neprilysin. Normally, neprilysin breaks down helpful substances in your body, ones that relax blood vessels. By blocking that enzyme, Sacubitril keeps those helpful substances around longer, which lowers the stress on your heart. Valsartan, on the other hand, is an angiotensin receptor blocker that blocks a hormone called angiotensin II from attaching to its receptor. Blocking this, it helps blood vessels stay relaxed and reduce fluid buildup, which can ease symptoms of heart failure. By working together, these two ingredients reduce strain on your heart and help lower your risk of serious heart-related events, especially in patients whose heart isn't pumping as strongly as it should. This is usually measured with something called left ventricular ejection fraction. Doctors typically prescribe Entresto when that number is lower than normal. In a large clinical study, patients who took Entresto had better outcomes than those taking enalapril. Over about 27 months, the Entresto group had about 20% lower risk of death from heart-related causes or ending up in the hospital. The downside? Cost. Entresto works well, but it's been expensive for a lot of patients, especially those with high copays or no insurance. That's why the approval of a generic version is a big deal. Generics can make medications much more affordable, and for a condition like heart failure, having access to effective treatment is critical. So where do things stand now? The FDA approved the generic a few years ago, but because of ongoing legal issues between Novartis and MSN Pharmaceuticals, the generic can't be sold until the earliest of July 16, 2025. For some patients, switching may make sense, especially if the price is more favorable or if insurance coverage is easier to obtain. But for others who are already doing well on the brand, continuing may be the better option. You can read more about Entresto on our website, so check those articles out in the links below. If you have any questions, be sure to ask your doctor or leave them in the comments below, and don't forget to subscribe. Bye for now.